my name's Bethany. I'm a student physical therapist. So today we're going to be doing some cranial nerve testing, if that's all right with you.
Yeah.
Can you cover your right eye for me? You read line 7.
FELOPZD.
Good. Switch eyes. Can you read line 7 but backwards?
DZPOLEF.
Okay. Can you stare at the bridge of my nose? Then just point to which one you see. So I'm going to come here. That one. Can you let me know which one's wiggling? Just point. Good. Good. Point to which one you see. Top. Bottom. Let me know which one's wiggling. Good. Good. Can I have you cover your right eye? Alright, let me know when you see this object, okay?
Okay. Yes.
Okay, let me know when it's wiggling.
Yes. Yes.
Cover your other eye for me? And let me know when you see the object.
Yes.
Okay, is it wiggling?
No. Yes. Yes.
Abnormalities for cranial nerve 2 or the optic nerve would be inability to read a line on the Snellen chart and inability of either eye to detect their peripheral field of vision.
I'm going to say thumb. You're going to look at my thumb, finger, look at my finger. Finger, thumb, finger, thumb, finger, thumb, finger. Good. Look at this point. All right. Just follow it with your eyes. You'll start up here. Can you stare at this point? Just look at it. Good.
Abnormalities for cranial nerves 3, 4, and 6 or ocular motor, trochlear, and abducens would be non-smooth or choppy pursuit of the pen, presence of saccades, misalignment of the eyes with convergence-divergence testing, along with improper constriction and dilation, droopiness of the eyelid, double vision, as well as diminished or absent pupillary light constriction with the targeted eye and opposite eye.
Raise your eyebrows, like surprised. Okay, now frown like you're mad. Good. Can you smile? Show me your teeth. Good. And then can you puff out your cheeks? Good. Okay, now tighten your jaw really quick, like you're biting down. I'm just gonna feel. Is that okay with you?
Yes.
Okay. Good. Even on both sides. Can I have you just relax your jaw? Close your eyes. Good. Okay. Good. I'm gonna be pushing up against your jaw. Is that okay with you?
Yes.
Relax your jaw. I'm gonna try pushing you up. Don't let me move you, okay? Good. Now I'm gonna try and open your jaw. Don't let me move you. Good.
Abnormalities for cranial nerve 5 motor component or the trigeminal nerve would be asymmetrical feel of the masseter muscle, a hypo or hyperreflexive jaw jerk response, along with fatigable weakness with jaw resistance.
Can you close your eyes tightly? Don't let me open them, okay? Good.
Abnormalities for cranial nerve 7 for the motor component of the facial nerve would be asymmetry of the face during any of the movements and fatigable weakness on one or both sides with resistance to eye opening.
This is for reference. Do you feel it on both sides?
Yes.
Close your eyes and say yes if you feel it.
Yes. 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 Yes.
Let me know if you feel it on both sides equally, okay?
Okay. Yes. Yes. Yes.
Alright, so this is the sharp side, this is the dull side, okay? So this is what you're gonna feel. Dull, sharp. Close your eyes and I want you to tell me if you feel dull or sharp, okay? Alright.
Dull. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. 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 Sharp.
Abnormalities for cranial nerve 5 sensory component or the trigeminal nerve would be decreased or unequal sensation on either of the three branches of the trigeminal nerve or painful response to a dull, non-noxious stimulus.
Okay, can I have you take your shirt off? I'm going to check your trap muscle, and I'm just going to be testing it, okay? Shrug your shoulders, bring them up towards your ear. Good. Good. Okay, come back down. Let's just do the left. All right. Don't let me move you, okay? Good. Other side. Good. Don't let me move you. Good. Rotate your head towards this side. Good. Okay. Don't let me move you. Good. Other side. Don't let me move you. Good.
Abnormalities for cranial nerve 11 or the spinal accessory nerve testing would be visible asymmetrical atrophy or fatigable weakness with resistance of the SCM or upper trapezius muscle.
In my pocket, I have 2 cents that I'm going to be putting under your nose, and you're just going to do your best to identify what it is you smell, okay? So go ahead, close your eyes. Put a finger over your right nostril.
Peppermint?
Yes. Cover your other nostril now.
Coffee?
Good.
Abnormalities for cranial nerve 1 or the olfactory nerve testing would be loss of sense of smell or inability to distinguish between scents.
Stick out your tongue. Okay, open your mouth for me. Say ah.
I'm also checking for abnormal protrusion of the tongue or deviation to one side while also assessing her speech and listening for abnormalities such as garbling of speech or dysarthria, which would be abnormal results for cranial nerve 12, otherwise known as the hypoglossal nerve.
Now I'm going to be putting something identifiable on your tongue, and you're going to tell me what you taste.
Okay.
Close your eyes. Stick out your tongue for me. And don't put your tongue back in your mouth, okay? Just tell me what it is you taste.
Sugar.
Sugar, good.
Salt.
Salt, good. Stick your tongue out again.
Salt.
Good. Stick your tongue out again. Sugar, good.
Abnormalities for cranial nerve 7 or the facial nerve for the sensory component would be inability to differentiate between the salt and the sugar or absent sense of taste on the anterior 2/3 of the tongue on either or both sides.
Take a drink of your water now. Don't swallow yet. Okay, if I feel your esophagus. Good, okay. Go ahead, swallow. Good.
Abnormalities for cranial nerve 10 or the vagus nerve would be hoarseness or nasal quality of the symmetrical elevation of soft palate and the uvula, asymmetrical feel for swallowing, and or gurgling sounds or inability to swallow.
Close your eyes. Point to which ear you hear a noise coming from, okay?
Okay.
Good. Good. Are they equal on both sides?
Yes.
Or point to which ear you hear.
Okay.
Good. Good. Keep your eyes closed.
Yes.
Let me know when it stops.
It stopped.
Good.
Yes.
Let me know when it stops.
Yes.
Okay, was that sound louder than the one by your ear?
No.
No, which one was louder?
The one by my ear.
Okay,
Yes.
you hear it?
Yes.
Is it equal on both sides?
Yes.
Okay. I'm gonna tilt your head a little bit, is that okay?
Yes.
Alright. Okay, can you just stare at the bridge of my nose? Head a little bit, okay? Can you take your shoes off? Alright, and then I'm gonna have you come sit up on the table. Good. Alright, back up a little bit for me. Right there. Okay, now I'm gonna raise you up. Alright, and I'm gonna hold on to you, okay? and I'm gonna lay you down, and then we're gonna hang out there for a minute.
Okay.
I'm gonna hold on to you here. Go ahead and hold on to my arm, and I'm gonna lay you down. All right. Ready? Go. Good. How do you feel?
Okay.
Good? Okay. So good?
Yes.
Go ahead, come up. Still feel okay?
Yes.
No symptoms, no dizziness or anything?
No.
All right. Let me go to the other side. All right. Can you look at me? Good. Actually, can I have you scoot over towards me? Good. Okay, go ahead and hold my arm. Same thing, we're gonna hang out there for a minute, okay?
Okay.
All right, and feel okay?
Yes.
Good. Feel okay? Any symptoms? No dizziness or anything?
No.
All right.
Abnormalities for cranial nerve 8 or the vestibulocochlear nerve would be inability to hear rustling of hands in either ear, hearing louder on one side compared to the other, hearing the tuning fork louder than the finger rustling, inability to keep the eyes focused on target while their head is moving, dizziness, nystagmus, double vision, or loss of consciousness.